I'm doing the forearm and the wrist, and I'm starting with the bare skeleton of the forearm and hand. Here we have the radius and the ulna, which are the two long bones of the forearm. The ulna is located medially, and the radius is located laterally on the pinky side. Distally, the hand is composed of three major groups of bones. We have the carpal bones, which form the wrist, and then we also have the metacarpals, which help to form the palm, and then finally we have the phalanges, which form the fingers. The carpals are arranged in two rows, forming a curved bony arch that creates space for the carpal tunnel. These bones allow the wrist to flex, extend, abduct, and adduct. The metacarpals are numbered 1 through 5, starting at the thumb. At the distal end, each finger contains 3 phalanges. We have the proximal phalanx, the middle phalanx, and the distal phalanx, except for the thumb, which only has 2. These bones together form the structural framework that supports hand movement and dexterity. Now I'm adding the connective tissue structures of the forearm and hand. The most prominent structure is the interosseous membrane, the thick fibrous sheet connecting the radius and ulna. This membrane stabilizes the two bones, distributes forces during gripping, and serves as an attachment site for deep forearm muscles. At the wrist, we can also see several small ligamentous bands and joint capsules that stabilize the carpal bones. Because the wrist is highly mobile, these ligaments prevent excess sliding or separation between carpal bones during movement. Next, we see one of the most clinically important connective tissue structures of the wrist, the flexor retinaculum, also known as the transverse carpal ligament. This thick band converts the anterior wrist into a tunnel, the carpal tunnel, through which the flexor tendons and the median nerve travel. Compression within this space leads to carpal tunnel syndrome, a common source of hand weakness and numbness. On the posterior side of the wrist is the extensor retinaculum, which binds the extensor tendons close to the wrist joint. Without this structure, the tendons would be bowstring during extension. As we turn the hand back around, we now see the palmar aponeurosis, the triangular fan-shaped sheet of connective tissue overlying the palm. It protects the underlying neurovascular structures and anchors the skin to allow a firm grip. When looking at the digital fibrous sheaths, distally the flexor tendons are enclosed within these, which form a tunnel system along each finger. These sheaths keep the tendons aligned against the phalanges during flexion, allowing precise and powerful finger movement. Inside them are synovial membranes that reduce friction as the tendons glide, critical for smooth, pain-free motion. Now, getting into muscles, I'll start off with the intrinsic muscles of the hand. These muscles originate and insert within the hand itself, allowing for fine motor control. Specifically, we can see small muscles along the metacarpals responsible for movements such as finger abduction, adduction, and precise flexion at the metacarpal joints. These muscles are especially important for activities requiring precision. Intrinsic muscles fill the spaces in between the metacarpals and attach to the proximal phalanges. Among these include interossei, lumbricals, muscles of the thenar and hyperthenar eminences, although only some of these are clear in the video. Here, the deeper layers of the forearm muscles are now visible. In the anterior compartment, there are several muscles that are in the deeper layers of the forearm muscles. These include the flexor digitorum profundus, the flexor pollicis longus, and the extensor carpi radialis brevis. These muscles allow for strong finger flexion and thumb flexion, as well as forearm pronation. In the posterior compartment, the deep muscles include muscles such as the extensor carpi radialis brevis again, the supinator, the extensor pollicis brevis, and the extensor indicis. These muscles are critical for grip release and fine thumb positioning, as well as thumb abduction and extension. Looking at more superficial forearm muscles, These muscles originate on the humerus or proximal forearm and extend distally toward the wrist and hand. These include the flexor carpi radialis, the flexor digitorum superficialis, the extensor carpi radialis longus, and the flexor digitorum superficialis. All of these muscles primarily flex the wrist and fingers and assist with pronation. As we get into the posterior compartment of the forearm superficially, there are a bunch of muscles in the back, such as the flexor carpi ulnaris, the extensor carpi radialis longus and brevis, the extensor digitorum, and extensor carpi ulnaris, which will all be shown here. These muscles extend the wrist and fingers and help stabilize the hand during gripping. You can also see how the tendons extend distally into the hand. These tendons pass under important connective tissue structures, like the extensor retinaculum, which keeps them aligned during movement. Finally, at the most superficial level, we can see the brachioradialis, and that is it for the muscles. Now I'm adding the arterial system of the forearm and hand. Here you can see the major vessels that carry oxygenated blood from the arm into the wrist and digits. To begin, the brachial artery enters the forearm just below the elbow and immediately divides into two terminal branches, the radial and ulnar arteries. These are the main vessels supplying the entire forearm and hand. On the lateral side of the forearm, we can see the radial artery. The radial artery travels distally along the lateral border of the radius, remaining superficial. This is why it's super common for palpating the radial pulse. As it approaches the wrist, the radial artery curves dorsally around the base of the thumb. On the medial side, we have the ulnar artery, which travels deep beneath the flexor muscles on its way to the wrist. At the distal forearm, the ulnar artery becomes more superficial and enters the hand just lateral to the pisiform bone. The ulnar artery is the primary contributor to the superficial palmar arch, which we will see more clearly in the future. We can see the superficial and deep palmar arches now as we go closer to the hand. These arches are formed by the joining of the radial and ulnar arteries and provide collateral circulation to the hand. The deep palmar arch, located deeper between the metacarpals, is primarily supplied by the radial artery, whereas the superficial palmar arch, which lies just beneath the palmar fascia, is mostly supplied by the ulnar artery. Together, these send digital arteries into the fingers, ensuring consistent blood flow even during gripping and compression. Now you can see the main veins of the forearm. The first main one is the cephalic vein, which runs laterally. Then you can also see the basilic vein, which runs more medially. These two veins are connected by the median cubital vein at the anterior elbow, and although it isn't visible here, it is one of the most commonly accessed veins for blood draws. In the hand, the superficial venous network is organized into a series of dorsal digital and dorsal metacarpal veins, which converge to form the dorsal venous arch on the back of the hand. The dorsal venous arch drains upward into the cephalic and basilic veins. The arrangement is super important because swelling, trauma, or cast can significantly affect venous drainage and hand function. Finally, looking at the nerves of the forearm and hand, here running down the midline of the anterior forearm is the median nerve. It travels between the two heads of the pronator teres and continues distally deep to the flexor digitorum superficialis. This is the primary motor supply to the anterior forearm flexors, except for the flexor carpi ulnaris and half of the flexor digitorum profundus. It also innervates the thenar muscles and the first two lumbricals. At the wrist, this nerve passes through the carpal tunnel, making it especially vulnerable to compression. In the hand, it provides sensation to the lateral 3.5 digits, the thumb, index, middle finger, and radial half of the ring finger. Next, we have the ulnar nerve on the medial side of the forearm. It enters the forearm by passing behind the medial epicondyle, the spot where you feel the funny bone sensation. It then travels alongside the flexor carpi ulnaris, giving motor supply to the flexor carpi ulnaris and the medial half of the flexor digitorum profundus. At the wrist, the ulnar nerve passes superficial to the flexor retinaculum rather than through the carpal tunnel. In the hand, the ulnar nerve is the dominant motor nerve. It innervates all intrinsic hand muscles except for those supplied by the median nerve. It provides sensation to the medial 1.5 digits, the little finger and half of the ring finger. Finally, on the lateral and posterior side, we now see the branches of the radial nerve. The radial nerve enters the forearm by dividing into a superficial branch and a deep branch. The deep branch, which becomes the posterior interosseous nerve, supplies all of the extensor muscles of the forearm, making it the primary motor nerve of the posterior compartment. The superficial branch remains sensory only and travels distally along the lateral radius. It provides sensation to the dorsum of the hand, especially over the thumb and proximal dorsal surfaces of digits.